Bring one of the hosts to be with us for the mic. تفضل يا دكتور.
شكرا للدكتور الله يعطيك العافيه. هي جايه من قبل بس احنا جيت السعوديه علشان
الله يحفظك يا دكتور كلك زول. سعيد بوجودك.
The only question that we leave always from the patients is how long it's going to stay. The thread. We answered that it's going to stay 1 year almost, plus or minus. Is it still true? I mean,
It's 100% true. Don't promise more than this. That's the reality. I don't know how is your way, how is your marketing way, how is the center you are working at advertising, but the reality, it is 1 year plus or minus 10%.
Thank you.
Most welcome. Okay, ready? Okay, now we're gonna talk about what we can do with any 6D threads or generally VGO threads. There are 7 zones we can do. Number 1, let us talk about the first zone, which is the eyebrow. Look at the eyebrow. There are many ways that you create a different shape of the eyebrow. That depends on two things. If really I'm treating something, I have a small fold, I have a problem that the his eyebrow is falling down, or it's just only a cosmetic purpose. If it is only a cosmetic purpose, I have to ask the patient. I give her a mirror. We are assuming, by the way, so I'm giving her a mirror. I'm telling her, do we have a mirror?
I know I'm
You have?
I have a little.
A small one
mirror.
is okay.
Okay, let me bring it.
I'm telling the patient with my finger, do you like that? Do you like that? Do you like that? Anywhere she wants, I'm gonna choose as the central vector of left. So, there are only one point I cannot put the threads in. Which point I cannot put the thread? The most medial one. Do you agree? Anybody agree about this point? Dr. Mona? That the only point we cannot put is the most medial one? Or 1 centimeter from the median? It is, the second answer is a little bit correct. Because where is my problem if I put the threads here? What is the problem? Nothing. Okay? The only problem if you put the thread above the supraorbital notch. When you put the threads above the supraorbital notch, the supratrochlear nerve is the big nerve, it's the thick nerve. If you put the anesthesia, the threads, blah blah blah, some edema, some little hematoma, the patient will have a pain and paresthesia for 4 to 6 weeks. Okay? That's why we avoid putting the threads above the supraorbital notch. Before I started to do this kind of techniques, again, people were so afraid to put the threads here or the medial aspect. No, only you did the lateral third, maximum the lateral half. That's not correct. You can do everything you want to do. Let us assume that patient, look at the mirror, madam. Look at the mirror. Madam, do you like if I make like this for you? You like? Or you like this more? Or you like this more? I give you all the options. 1, 2, 3, 4. What you want? I like this. You like it?
Yes.
Okay. If she likes this, what you have to do? At the center of your finger, just make a little mark. Okay? 1 centimeter medially, make another mark. 1 centimeter laterally, make another mark. That's 1 centimeter. Okay? And then what I have to do now? 3 straight lines parallel till the end. Where do I stop? I stop around 1 to 2 centimeter after the hairline. 1 to 2 centimeter after. Enough, madam. Put down, yeah. Okay? So in the other side, I will do the same. I put the 3 lines, 1 centimeter in between. Where do I stop? Where do I stop? 1 to 2 centimeter above the hairline. For what purpose? Why I go to this another zone? Why? Because I want fixation. Because this is a zone, from one zone to another zone. That means I have achieved lifting. Because this type of threads, you have to move the laxity from one zone to another aesthetic zone. And you have to have a fixing and the anchoring point. We have always to remember that. The issue is you will have 1 million concept, 1 million wrong concept in the market. Okay? Especially in the eyebrow. First, you cannot put in the medial aspect. It's wrong. You can put. Second, you cannot put to wherever where. Third, you have to collect the threads. Why we have to collect the threads in the eyebrow? Why? What happens when you collect the threads? You will have what? Volume. When you collect the threads, you will see a little bit of collection of the skin hair. If the thread is meeting at one point, you will not have left. You will have like a kind of volume here. Do you need a volume in eyebrow? That means you have to go straight. Don't collect the threads of the eyebrow, please. Okay? Second, one patient came to me. She always injecting Botox for 5-6 years, but still this area of the glabella is just falling down like that. What you will do for her? Nothing, except if you can do threads. I did for her that. Look here. This is the center exactly. I put one. 1 centimeter medial, I put one. 1 centimeter here, I put one. At the beginning of the eyebrow, I put one. Here, I put one. I put in this area, guys, 5-6 CD threads in this area. Okay? 5-6 CD threads in this area. The patient were about to dance in the clinic. Okay? She was, by the way, a royal family. So, you have no limit if you work in a proper way. If you understand what you are doing, you have no limit. You can do what you want. You can make your patient happy. You have a lot of solutions. Okay? Because this area has no solution. If it's falling down over flipped, there's no solution. The only solution, if you put threads, you can put threads like that. It's no problem at all. Okay? That's not an issue. That's a really very, very nice and good result. Okay? What else I can do? Okay, for example, you have a patient with facial palsy. Okay? This eyebrow is like that. I also put in the lateral third and leave the medial like that? No. You can put everywhere. You can put one here, one there, one here, one there, like 4 threads to try to lift the whole eyebrow. Okay? So, there are a lot of things you can do if you understand the concept. What I want, I will do. Which area I want to lift, I will put the thread on it. Okay? So now we are done almost with the eyebrow. Nothing more to do. There are also a big crime people do. I see sometimes in video and live videos. They start the threads from here. Is this logic? Okay? Is this logic? Why people do like that, I really am not understand. The threads have to start from the upper border of the eyebrow. Not below the eyebrow. If you go below the eyebrow, you will take the eyebrow with this shape, with the same look like that. And you will not lift very well. So we always start from the upper border of the eyebrow, not from the lower border. Plus, so you can do everywhere. Oh, for example, if she wanted more lateral, I don't mind. I can put my finger here. That's the main point. 1 centimeter medial, 1 centimeter lateral. That's my 3 threads. Okay? So, it depends on what you want. I will do what you want, not what I want. But very important, you have to test with your finger. Because if you don't have laxity, if the skin is not moving with your hand, will never move with the thread. You will never have result. You have to understand that. If I do like that, and the skin is not moving, because sometimes people say, I did the eyebrow, but I didn't have result. Okay, because you didn't check if you'll be able to have result or not. Okay? Dr. Abdo, excuse me for 1 second. Come to me. Come to me. Look here. Dr. Abdo, for example, if I want to do, look. You think he will have good result or no? Beautiful result. But for example, if I came to another person and I'm holding, he's not moving. What I will do? Nothing. So you have to tell him that's not your option. Maybe you can do a little first Botox and then again you make reassessment and you see if it's going to be lifted or not. But we have to understand. I know the result before I start. I know that my result for all cases before I start because my hand is telling me what is going to happen. Okay? Thank you, Doctor. Thank you so much. Okay? So now I told you I can make threads everywhere I want except what? Look, what is this? What is that? Supraorbital notch. Okay? So this is the only point that I hate. This one, look. This one is bad. Don't put the threads here. Okay? This, which is, as you see, like 1.5 centimeter between from the inner part of the eyebrow. Okay? So, now we finish the story of the eyebrow. Let's go to another story. Another story is we have two types of patient coming. One person are coming to tell me, please, I want to open my whole eyes. And another person, I want the cat eye. You have to clarify what do you mean by cat eye, because sometimes the patients are coming with a different terminology that's even they don't understand what does it mean. Okay? So, for example, there are two things when it comes to this cat eye and stuff we can do. First is, look, some people think this is the cat eye. You see? Okay. This is the cat eye. Which is what? Pulling the eye just lateral. Okay? Like that. If I want to do that, how is my situation? What can I do? Nothing. This is my hand, right? I put the thread the same like my hand. She wants that? Madam, you like that? Yeah, I love it. Look at the direction of my finger. This is the same direction of the thread. This is number 1. This is number 2. And these threads, we're gonna go like that with the same direction. Tell her. Okay? So that's what I will get, because this is what I did. Okay? So this is the first way to create what we call a cat eye. But let us assume this is not what the patient wants. Because sometimes the patient wants the whole eye to be open. Okay? That's more into, like, I don't know, some people like it, by the way. It's for me more Chinese look, but some people they really like it, like that one. Let us assume for this one that she needs to open the whole eye. Madam, you like your eye to be open like that? Yes. We are just assuming, yani, no problem. Hey. So let us assume she told me, yes, I love it. That's what I want. You have to do, look at the lateral part of the eyebrow. You have to do like a semicircle, continue like that. Okay? Because this is my entry line. I will do something called sun rays technique. What does it mean, sun rays? The sun is going that way. So, you will go from narrow angles to wide angles. That means, look. This is 1. Okay? This is 2. This is 3. Okay? In some cases, you can need even 4. More down, in between, blah, blah, blah. But this is like this. Okay? Like that. So, you can do going from down like that. Okay? Start with 1, just straight at the lateral part of the eyebrow. To the lateral part of the eyebrow, go straight. When you go more, little angle. When you go more angle. When you go more angle. So we'll have like what we call a sun rays technique. It's like that. Okay? Everybody is going in its own way. Out. Okay? It's clear? Tamam? Okay? Look, what this can happen for you. What can make for you. Like that. Okay? So that's the way, as I told you, the first 3 you can easily do 16, 19, no problem. The only one that if you have to be very careful when you do that one, because it's really painful and tight for you. So now we finish the first zone. Anybody has any comment about this zone? Any question about this zone? The doctor is asking a very valid question. Do we have to inject botox before we do the threads? What is the answer? The answer is no. It's irrelevant. It's another story. If you want to do the botox just for the botox, do it. If you want to do the botox just to insert the thread easy, it's not my main objective. No. I don't work on the muscle. I work always on the skin. I am taking the skin and go up with it. The muscle is under me. I am not attached to the muscle at all. Okay, so that's also another, thank you so much for raising this point, because this is also another wrong concept in the market. Why the people tell you like that? Because they have weak techniques. That's why they're telling you, okay, the Botox will do a little lift, and then I continue the lift, and the muscle will be relaxed, the movement will be less, the threads will be staying more, so that's the issue.
I wanted to ask, regarding the cat eye, the area between the angle of the eye and the hairline, it's too short. Should I insert the thread a little bit longer after the hairline, or still one or two?
No, come on. You cannot stare. Look at my lines. You see my lines? Look. Did I stay? Did I stay at the hairline? Yeah, I mean.
Centimeter is enough, or shall I?
No, for this one, like 3-4 centimeters. Look where is my lines are reaching. I reach it now. You see? Of course. Yeah.
Cases which has so much pain here.
Everything.
I need lifting for eyebrow,
Thank you.
but the patient has too much
Thank you
space
so much.
on the area.
Yeah, there are two reasons.
Yes.
The first reason, that at the end I want a little superficial. When it is superficial, it causes pain with any movement. The second reason, that the muscle, as the doctor said, may be so active, so too much movement, and then the patient feel pain. And in both ways, the solution is very simple. You see what is this point? 2.5 Botox hair at the insertion. 2.5 Botox hair. 2.5 units only. So you have need 5 units of Botox in the area of insertion. Not normal Botox for the forehead, no. Just here. And
Stop
between.
moving. That means to stop moving.
Yes. No, you do it in case of the patient have some pain after 10 days. Okay? In case of. Okay, any other question, or we can move to the second zone? Because the second and third zone are very, very simple and easy. Yeah. No, it will never do scars, but it will, oh, this is a very good question. Because some people now put the threads in the scalp. Huh? No, I mean, no, there's another issue. Do you think when you put the threads in the scalp, it will induce hair growth? I swear to God, go get it. Look at the YouTube. Yeah. Yeah, it's for sure to me. There are a lot of people that they make training and they make drama and do live and make videos and post it on Instagram and YouTube. They insert things in the scalp. The case of alopecia are not affected by me. I never reach to the head follicle because I'm also always under subcutaneous. Okay? So you can do. Scars for what? I don't exit. There is no exit. No. This is cannulus thread. You go insert, press and go up. There is no exit. Only end point, fixation point. Come on. We go to the second zone. The second zone is the most easy zone. Come on. Look. The mid face. Mid face. When we lift the mid face, we go towards where? Mid face. Go to. I want to hear. Thank you. Temporal zone. Okay? Why? Because this is the normal anatomy. This is what the patient does. This is the lifting. This is the weight. Okay? Normally, standard for each zone, I need an average of 3 threads per zone. This is the average. How I put these 3 threads? As we agree, I'm gonna start from down up. Why I'm gonna start from down up? Because this enables me to go up and fix the threads in the temporal tissue. So the threads will be strong, will be anchored, will be fixed. When I pull it out, I cannot pull it out. It's gonna stay longer, and they have even immediate good result. Very strong immediate result. Okay? So this is the main purpose. Some people will tell me a very strange concept. This is against the gravity, so you are doing wrong. I don't understand what is the rule of gravity in threads insertion. But by the way, I heard this from more over than 20 persons, 20 doctors. 200 doctors. When I go to the clinic to do the training, told me, no, you are doing something wrong because this is against the gravity. I don't understand what does it mean against the gravity, but they will teach like that, they taught like that, they trained like that you have to insert with something, I don't know what is gravity or something like that. So that's also you will hear in the market. This is wrong, you are doing wrong because it's not graffiti, I don't know. And also, another question. No, this is wrong because this is not the proper direction of barbs to do lifting. The barbs has to come from up to down, so the lifting going from down to up. This is again, it's just a drama because these people, they never read a word since 10 years. This was only applicable when we have the unidirectional threads. In unidirectional threads, they're designed to start from here to down, but you have to tighten, to make a knot, to fix, to anchor, to stitch up. This is the only direction. But with these types of threads we are using, that was like 6-7 years ago, halas, this is no more valid. Okay? So this question you will hear. So we will start from down to have better result. We start from down to have more fixation up because the thread at the end exactly like this pen. Do you know the thread is exactly like this pen? When you have at the end, you have what? You have a part of the thread flipped over. You know that, right? There's a blue part of the thread. This one you think should be in the loose area or in the tight area? Should be in the anchoring area or in the free area? The fixation one, this one. Of course, when it is fixed with double thread like that, it's better to fix with that one. When you have fixation with like angle, it's better to have. We are doing this sometimes to make what we call a virtual angle. So it's already coming in the thread. So it's much better when you insert that way and opposite to insert that way. That's really obvious. So when you insert the end which has the flip, which has the round part, is much fixed. When you insert that one, which one is fixed? This one? Or when you insert this one in a tight area? This is the one that has the loop. The loop one will fix more. So that's more reason to start from down up. Now I'm gonna work. Okay, first of all, where is my first entry point? I go from the base of the nose till I cross the nasolabial. Always stretch the nasolabial so it doesn't give you a false impression it's 0.5, and then when you enter and then you do lifting, you find yourself in the middle of the check. You have to know what is really 0.5 centimeter, like that. That's the first entry point. Half centimeter lateral to the nasolabial so you can be able to lift the nasolabial and take it with you out. And at the level of the base of the nose. Does the nasolabial start at the base of the nose? Where the nasolabial start? At the elanizal. So why I didn't put my first thread at the level of the elanizal? Because of two reasons. Can you tell me one, Doctora? Yeah, it will change the shape of the nose and the nose will be more widened. What is the second reason? Exactly, the second reason that when I go, I will pass under the eye, I will have more bruises, no fixation, I will have a weird shape. So that's why I wait till the nose finished, so I have a clear angle and I can work properly. Okay? So my first entry point at the base of the nose. Base of the nose, lateral to the nasolabial by half centimeter. Then, my first point. I told you, we work zone by zone. Where is the end of the mid-face zone? At which level? Angle of mouth. So my last point should be either at the angle of mouth exactly or 1 or 2 millimeter above. Okay? So. Also, it has to be lateral to the nasolabial 0.5 centimeter. Okay? And if I want to add the third one, where it is? Exactly in the middle in between. So that's my third one. Okay? Fantastic. So, where I should go now? To the temporal, exactly, I collect them to the temporal bone. Do we collect the threads in the chest? Yes. Why? Because we need volume. Okay? We need a volume contour. Okay, some people tell me, no, I have a heavy cheek and I have some people that already have volume. You will be surprised that it looks much, much even nicer when you do this kind of collection. Because the problem is when you have a heavy face and you have a heavy cheeks, the volume is coming more anterior, is here. But when you put the threads, the volume will come to your hair. So the face will look really different and nicer. So do it, except if you have a male. When you have a male, you're gonna do the same shape and collect the stick to the one point? No, because you will have a feminine look, feminine cheek. That's why what we do if I have a male. I designed the standard point that I should collect the thread, and 1 centimeter, sorry, half centimeter medial to it, half centimeter lateral to it, I can add the other 2 threads. So the one that it should be standard will be the middle one. Okay? For example, I should collect it to this point, all the threads. Okay? So what I will do is I will create another one here and another one here. So it's gonna be 3 points near to each other, and then I collect the first one to this, second one to this, third one to this. So it's gonna be each one go to 1 point. Anyway, not parallel, no. It's no. Look here, look, because you are starting from this distance, and yeah, so it's gonna all back. Okay. Okay. Anyway, even if you are confused, you can do even the 3 to 1 point as we did before. Okay. So now we will design where we end. This is the temporal zone. Where is the temporal zone? This is the temporal zone. Madam, this is the temporal zone. Aha. How I know this? Just like that, or there is also like calculation? There is a calculation. Medically, you can put your pen or one finger in front of the tragus like that, and you can take a line from the upper border of the eyebrow, the highest point in the eyebrow, and you go till the meet. Oh, the meet here. So this is my point, which I choose already in the video. So this is my 3 points. Now we'll go to that. There's 1, there's 2, and 3. Okay? So this is my 3 points going to that. I finish the mid-face zone. We'll go now to zone number 3, which is what?
Lower face.
The lower face. Lower face itself is divided into 2 zones, which is marinate and jawz or jawline. So the marinate is a fold or not a fold? It is a fold. So what we can do if we have a fold, you have to go half centimeter lateral and try to ball it. When I ball the marinate line, you think I should take it up to the temporal zone? Why? Why no? Why I should not? That's one reason. But there are also more other reasons. No, it will never cut such strong thread.
Almost started from up and like the vector direction.
Yeah, it is a vector, but the vector is the issue is I cannot have one vector of left with 2 different zones. Otherwise, the face will not have a shape. Will be like a balloon. I want to create shape. If you want to create shape, you have to define the face. You have to differentiate the zones from each other. I have to differentiate, make demarcation between the zone and the other. I cannot take all the fish like that. This is a fish. This is a moon face. This is not what we are looking for. We want a definition. We want the patient to have a shape. That's why we separate the vectors of left. We have a different vector of left, and the issue will follow the anatomy. The anatomy, when some patient coming to you and tell you, I want to do the jawline, she's telling you, please do the jawline for me like that. What she's telling? I want that. That's what you want. So we take the marinade to the tragus. The marinade goes to the tragus. So just above the marinade, go to the tragus. Okay, now I have no anatomical landmarks to create my entry points. So what should I do? I should create my landmark. Because in the nasolabial, you start after the nasolabial. In the marinade, you start after the marinade. So what about the rest? What I will do? I have to create my own landmark. What is my own landmarks? I'm gonna start a line coming from the angle of mouth down, like that. I'm sorry if you're bored, but we have 10 minutes to finish. Okay, just start straight line from the angle of mouth down. Straight line from the angle of mouth down. Okay. What's the benefit of this line? This is gonna be my entry point line. So if I want to do the shower, usually we agree the zone require almost 3 threads, but sometimes even if this simple case, you can put only 2 in the lower face. It's more than enough. So I put another one just above the jawline. Look, the jawline, just half centimeter above the jawline, you're gonna go till the air lobule, like that. So that's my jawline definition thread. Okay? I have no, you will not need to pull this area to up and to move all the way around, and when she talk and eat, you will feel the thread will move. No, you work anatomically. This is the jawline. This is the jawline. I should not do the jawline like that. Okay? So, now I finish the jawline. I finish this zone. 2 threads is enough. If I want to add one more, I can add one more. Either to marinate or just above this one. I can add another one here if I want. Like that. Parallel. Down we are parallel. Why we are parallel? Because we don't need what? Volume. We don't need volume. So we are parallel. Halas? Okay. So now we will start the submental and neck. Same story. You have your line. You can start from your line. How many threads normally standard we need for the neck? Standard 3. Better 4 if you have a heavy neck. If you have a male, start even with 4. So the more threads you will put, the better result you will have. Because sometimes, okay, I put 2 and 2 and still have something here. This doesn't mean you have to put screw here. The screw here is a drama. What's the benefit of screw threads in lifting? If you have a heavy neck, what screw thread can do? You have to have a heavy thread, strong thread in order to have a good result. The problem, if this is still here, that means I have to add more threads. Okay? So try to do that way. This is also a big conflict with a lot of people. They tell me, why you don't put thread in the middle? Why you don't do the cross-crease technique? Or whatever, cross-crease, something like that. Okay? Because I believe that in lifting, okay, if I want to lift this area, I should bring the threads and come to this area? Or I should take the laxity out away from this area. So I don't do the crisscross. Okay? So we'll do now the marking for the third or fourth zone, zone number 4. Zone number 4. 1, just under that. We choose where is the laxity area. But by the way, she doesn't have laxity in the neck, but we are just marking. Next. 2 and 3. Do I have a limit?
No limit.
I can put 4, 5, 6, 7, 8. Okay, but do we have a limit anatomically not to go below? Wait, where? Yeah, where? What is this? Adam apple? Hyoid bone? Hyoid bone. I usually don't, I sometimes go below, but I don't prefer in the beginning, or not in the beginning, I mean the first 500 case to go below the hyoid bone. Because of many reasons. First, you have the thyroid here. You never know. If we do this line, it will come just above the thyroid. The second thing is, this area is very loose. The fixation here is not easy. So the threads can go down and show here. So it's not an area that's easy to fix. So in the beginning, stay till the hyoid bone. You want to add more thread. If you have a lower neck, Dr. Hanadi attended with me a case in hair clinic. The doctor, he's always a dentist. He had a big laxity in the lower neck. But did we put any threads in the lower neck? No. We stopped at the hyoid bone, but we put 5 threads or 6, I don't remember really, 5 or 6 threads in this area. And it lifts the lower neck, because when you do like this, it goes up with you. When you lift up, it takes all the down, but not the opposite. Okay? That's why when the people have a heavy jowl and come to you in the clinic and tell you, please, put for me 2 threads in the jowl. I want to remove this jowl. You will do the 2 threads. You will improve the case? No. Because if you want to remove the jowl, you have to start from one level up. At least 2 threads in the cheeks, at least, to be able to do that. Because if I have this shape, and you put the threads here, what is the benefit? Nothing. So I have to do that. Same concept of the filler. When I do cheek filler, it takes all the lower parts with it. That's what we have to understand biomechanics. We have to imagine. Okay? Actually, this is for me, it's not medicine. It's just like mechanics, I think. So, okay, so this is this ready for the neck. We can go without the crisscross, and we try to go the maximum we can. Try to go the maximum we can to fix near to the mastoid in the mastoid fascia. Fascia is the first one. That means I have to cross the sternomastoid. Yes, wallah. Wallah, I have to cross the sternocleidomastoid. If you didn't cross the sternocleidomastoid, you will have result less than 40%. If you didn't cross the sternocleidomastoid, you will never have a good result. We have to cross. We have to go more, further, after. So we have to do a real lifting and a real fixation. Okay? So now we finish the zone number 1, 2, 3, 4. We have now 2 zones. We have 2 zones now, which is like a kind of something very modified. We have the nose and we have the lips. So I don't know if we mark it all in the same patient will be clear, or you think we change the model for the okay. Sorry, Doctor? No, I mean the marking. I want to finish the whole marking. Maybe I mark and then I can remove it again. Dr. Abdul, can you please help me to remove the marking in the center of the forehead? I want this, this one only. Okay, this one. I will do also marking of nose and lips on the same model. Then we start working. But guys, what do you recommend me to do for this model? I want to do for hair. I want to do eyebrow, mid-face, and lower face. Okay? I don't like when I say like jawline or mind, or let us always work with zones. Zone, okay? I will do 3 zones for him. Yeah. Try. If you ask for jawline, at least try to put one at the back. And then you do put at the jawline one. And then you can put under one. So you have to do it. Thank you, Doctor. The marker is really good, but it's better for workshop sometimes. In your clinic, you can do what you want, but when you are in a workshop, you have to see the clear lines very well. I'm sorry that if I'm taking long time, but this is really the most important part. After this, what we'll do? We'll do marking and put the thread under the marking. It's not. Okay? Doctor is asking when your patient do filler, how many days we can do the threads after? Few days. If the patient has no edema, no swelling, no pain, you start working immediately. No. Never do it together. Never. Because you never have, you know the shape, what will happen after. You have anesthesia, you have edema, you have cardiac trauma. So sometimes you have today's shape, after 1 week you have a completely different shape. So you cannot do it the same day at all. So what is the opposite? If I get threads, how many days I can do the filler? It's the same concept. Wait till all the edema and swelling and everything will go, which usually 10 to 14 days, and you will be able to do the just said like this few days, when the edema and pain and swelling go. You mean which is first? Okay. When we think if the thread can move with this kind of movement, it will not stay more than 2 weeks. The thread is fixed. I don't pull. That's a very important point, guys. I never pull the thread. I never do manual traction of the thread. Never do that, because what you do manually will fall down again easily. Try to insert the thread in the best position and leave it. Yeah, temple. Press it from up to down and pull it. Just like that. Pull it. Thank you. Where's my glass? Only with alcohol or chlorine you can remove. This marker with alcohol or chlorine you can remove. It's a line now, it's very good one. I only when you work in your clinic, it's only the entry point with the you can make the other within the pencil companion with the light and marker is not problem. But the entry point, I always make it with them. Doctora is asking for the contraindication. What do you think is the contraindication for threads? First indication, the contraindication is bleeding tendency or coagulation disorder. What is the second? Uncontrolled anything. Active autoimmune disease or severe autoimmune disease, because sometimes, for example, my mom or my grandmom, she has like rheumatoid arthritis for the last 30 years, she's taking 1 tablet per day and she's controlled. For me, this is not an autoimmune disease. But somebody with systemic lupus, for example, I'm not gonna do. With Hashimoto's thyroiditis, I'm not gonna do. But we have a real active autoimmune disease, yes, we don't do. Autoimmune disease, blood coagulation disorder, uncontrolled diabetes, especially if they are insulin dependent. Okay, but oral hypoglycemic drugs is not a big deal, but you have to be a little more careful because they feel more pain. Guys, diabetic patient with stress, they feel more pain, more edema, longer recovery time. So try to divide the session. Don't make more than 6-8 sessions. Yeah, maximum stress, you put 8. Don't put more than 8 per session. No, later on after 2 months you can add more. But don't start completely with the whole everything, especially for diabetic patient. Please, doctor.
For job lines, I sometimes put long threads from here to here. Is it something wrong?
It is not wrong, but in my way, I don't prefer it. It's not wrong. It's correct. Some people do, a lot of people do. It's not wrong. But if you work with that way, you will not be able, you will not need it. You already will have correction of the line before even you start putting any stress in the line. Okay, but it's not wrong.
I have another question. While putting the threads from here to here, in the first line, I have always difficulty in fixing into the stand Belladama state. Sometimes it even becomes like this. Is there an easy way for it?
There are two ways to do that. First, we got a thread which is 18G with a stronger cannula, so it help you to penetrate soon. I am not sure now it's gonna available soon in Turkey. Doctora, we have the heart lifting threads. It's now mainly for the heavy neck or the first thread athlete if you want. This is a 18G cannula. It's a thicker, bigger, very easy to penetrate. This is the first solution. The second solution, I am not able in each patient and in each thread to reach to the maximum. If I cross the anterior border of sternemastoid, it's even enough for me. But down, you can go more. Down, you can go more. But for the first thread, if you have difficulty, we will show now how to maneuver the difficulty and try to be patient and to adjust your angle. Sometimes, when you go more up, it's more difficult. If you found you cannot pass, go back a little bit, change your angle and go more down. And instead to finish here, try to finish 1 centimeter down. You'll find it easy to pass. Consider that the number 1 is number 2. The number 2 is number 3, So we will go a little more down, you will have not this difficulty. So this is also another solution. The last solution, if I didn't manage to pass with 1 thread, is not the end of the world. Just go out and put another one, okay? Thank you so much.
Sir, from your experience, when I can say to patient, you are not candidate patient for this.
When she is candidate for surgery.
I mean, this patient, skin redundancy is too much. It's not.
Thank you so much. Thank you so much for this. I think I was preparing for a workshop in Egypt and they are just giving me what is the limitation. With my technique, with the way that we are working, you have no limits in the face. You have no limits on the face. Any case of face you can do. Even the patient is 80 years old, you can do. Even the laxity is severe and extra severe, you can do. With the face, you have no limit. Each patient can get some benefit of my thread. Each patient. But the only limit for me is what? The heavy neck. The double chin neck was full of fat. It's not so common in Turkey, but in the Middle East we have. Like a patient coming goes like a neck, like 1 meter fat and telling you I want to lift this one. What kind of lift? It's common in Iraq, common in Egypt, common in the Gulf. It's very common in our region. So the only limit for me is the heavy neck was full of fat. But any other threads, okay, you can have maybe not optimum result, but you will have result. And good one. Dr. Shady.
Sorry, maybe you didn't mention for the contraindication for the dominant filler.
Sorry, thank you so much, Dr. Shady. This is one of the, for me, relative contraindication. It's not absolute because I did cases. I have a rate of infection of 20%, at least 20% or 30%, the level of infection, rate of infection of the. From the 10 cases of permanent filler you do, you will have 3 cases having disasters. But sometimes the patient is insisting because she has also no other option. But the permanent filler, if you work in a country with a very strict rules like Saudi, like whatever, don't do a cases of permanent filler. But for example, if I am in Egypt and the patient with a permanent filler came to me, of course I will do it. Okay? So it depends on the rules that you are. If you have very strict rules in the country, you are away from your country, you don't want to put yourself into risk, don't do the permanent filler cases. So thank you, Dr. Shelley, for this one.
Just also
patient using hypo. So we have to wait minimally 3 months after the hypo session to come back to
The opposite. You don't have to wait after the hypo. You have to wait after the threads. Not
after
to
the
do
threads,
hypo
yes,
three
after the
years.
threads, but I mean that even after the hypo directly,
Not affected.
really you feel that the tissue is swollen.
But when you have more time, the fibrosis will go more.
Yeah, in your cases, I don't.
In any case, I'm against the hypo.
After hypo.
In any case, I am against the hypo. I don't like hypo. Yeah, it's very hard to drive when you go do the hypo. Especially if I have some of my colleagues, one of the doctors in Dubai, she did 2 successive sessions of hypo, 2. And she came to me, she said, 2 threads. You cannot imagine how it's difficult to drive and how is the swelling after. Because if you have 2 sessions, because she is in the clinic, she's not paying money, the machine is in front of her all the time. So when she has a free time, she'll do hypo for herself. So I did for her and the swelling lasted longer. Really, more swelling and longer duration. The recovery is not bad. So I'm 100% against hypo because it's a competitor for threads.
The patient had surgical facelift before. Do you do?
Yes, I did.
What about edema and edema?
No, there is no edema. The only thing, thank you doctor for this point. The doctor is asking if the patient has previous facelifting. I did many cases that has previous history of facelifting. The only thing at the area of the scar is super painful. Painful even more. You have to put a lot of anesthesia if you pass under the scar at any point. Put a lot of anesthesia. It will facilitate the passage and decrease the pain. Because as you said, it is hard, it is fibrotic, so it is even more pain. It's tight, so you have to put a real lot of anesthesia at the point of the scar. Thank you so much, doctor. Any other question, or we can go to the nose marking? Any other question? Okay, we'll go to the nose marking. The nose marking, you know that this nose is not designed for the Asian nose. I didn't create, that's my, of course all the techniques you are saying now is mine, but especially this one is a nose, I'm so proud of it. Because usually it has a very beautiful result that most of the people don't believe it's threads. Okay? I have also one of our colleagues we did before. I don't know if you want to show himself or not, but one of the people in the room, I already operated him 7 months ago. I did for him nose left. Not you. But I couldn't easy. So one of the people he did, and still he showed to me yesterday, he's still happy with the result. Okay? I bought only for him 4, and usually I put for the male 5. 3 in the center and 2 as a cross-shaped nasal remodeling. So anyway, this technique is not for Asian people. That means it's not replacement for filler. This technique, guys, is similar to a minor surgery. It is a result of surgery, but not exactly surgery. Yani, it's something like can make your patient happy for the cases just below the level that needs surgery. And sometimes even cases that need surgery get good improvement. So this nose is mainly for Arabs, for European, for Caucasian, for Turkish people, for the people who have the nose a little bit longer, inverted down a little bit, the broad septum hair, the dorsum of the nose is broad. I can make it tapered, I can make it slim, I make the nose a little lifted, I can create a very good shape of the nose, but this is not for Filipino girls, it's not for Asian nose, please. Please don't mix this technique, because sometimes the people do it for a we're doing the workshop, there is no people except the nurse. Filipino nurse will do the Filipino nurse, it will not show. There is no benefit. This is for the people who have a big nose, not broad, wide nose, big nose, inverted nose. Okay? When the nose is big, I can make it short, I can make it slim, I can make it tapered, I make it look nice. As I told you, people think that they did surgery, and it is really very simple techniques. Total. I think I put this video many times when the whole case lasts 10 minutes from the patient entry into the room till he left out. It was all 10 minutes, including marking, disinfection, anesthesia, application of the thread, cutting the thread, cleaning, giving instruction, with all 10 minutes. All of that. So the procedure itself takes 3 minutes. Okay? So for Madame, I think she doesn't need, she has a beautiful nose. But we will find another case. Dr. Bassan, we have a case for nose, right? We have a case for nose. Okay. I will repeat everything again. 1, 3, 2, temporal zone, marinate, tragus, jawline, ear lobule. Maybe I can put one here just. Okay. When I put the eyebrow, I'm not gonna ask here again what you want because I know. I just try to find any landmark, so I do the same. So for example, the last thread here was at the level of lateral canthus. So the last thread here should be at the level of lateral canthus. So this is 1, 2. If you want to be more accurate, try to use a roller. You can measure the distance in centimeters. For example, if you want to be accurate, you have to make sure that this one, the distance to the midline is the same. This is like 4.2 centimeter. Here is 4. Almost 1, so it's no big deal. Okay, I think I should go a little more with this one, like that. Okay. So I put 3 and 3, 3 and 3, 1, 1, 1. Okay, let's go better do the disinfection and anesthesia. Any question before I start doing the application? Did you add sodium bicarb to the... Put little drops of sodium bicarb in each syringe, please. I will add sodium bicarb to the anesthesia, so it will be much less painful. Now we'll take 5 minutes of anesthesia. If anybody wants to bring coffee or do something, I'll just prepare the anesthesia.
How much sodium bicarb?
10%. Like, for example, you prepare 20 cc of anesthesia, for example. You put 2 cc of sodium bicarb. Bring the coffee and come to me. Dr. Abdu, can you do the anesthesia?
Yeah, okay.
I'll drink coffee also. We'll have like a 3 minutes break if you want to bring coffee, so we can do the anesthesia and so. What are you?
Onlar ara veriyor.
Nah?
Benim uyuşuyor. Uyuşuyorlar.
3 minutes. Only 3 minutes. We're not gonna...
Hocam şu an okey. Tam bakıyorum.
Yeah, I agree with you. No, I can use that one.
Can I take a picture for you?
Yes. İşlerime kadar uyuşuyor. İyi, çok şey Ben geliyorum
I think even here at the screen behind us.
Okay.
واحد طبعا يسميها تربية. هذا الأول بيضرب بلاستيك. الأول بيضرب بلاستيك. ليش الأول بيضرب بلاستيك؟
Nerede? Geçersiz mi? Niye geçersiz? Çünkü kamera full otomatik daha az. O yok mu çünkü ya? Şu zebra falan olabilir. Bomba değiştiriyor. Bombayı değiştiriyor.
Saçlarını mor yapmışlar çizgileri. Dersin yeni moda. Yarın yıkanınca geçecek, yarın geçer, yarın yıkanabilirsin.
Şunlara bas. Zebraya bas. Bas zebraya. Açık olan yani ha. İsterseniz çok hafif bu döndürebiliriz.
دكاترة maximum 2 minutes and we'll start عشان ما نتأخرش دلوقتي. Abdul, you did the anesthesia or not yet?
Yeah.
Thank you so much. You know that we'll do 3 eyebrows, 3 in the cheeks, 1 in the marinate, 1 jawline, and the first one only in the neck. I don't know if you know.
Yeah,
you did.
I did 3, but we can make just 1 or 2.
You okay with the pain? You add the sodium bicarb, the pain was this?
Yes, with epinephrine also.
Thank you so much.
Oh, she is good.
We love you, Dr. Abu. But also some anesthesia for the some sorry.
I
No, I need some sorry. Now we are ready to start our case. You know that we use the 2% lidocaine with epinephrine, 2% lidocaine with epinephrine. Also, you can add a little drop of sodium bicarb in order to have that less painful. Can you adjust? لا سيبني اديني بس جلافز طلع ونص ولا ده كده استلم ده كله ده اسمه ايدك يا ابن الموضوع Tuttu şeri gelir.
Biraz döndürebilir miyim?
Tabii.
Ama düşün.
Çayı al. Mutfak kılıyor da ziyaret eder misin?
Evet, önemli.
Tamam.
Görsünler diye.
Dr. Wasan, I need 2 cases of lips. 2 cases, not 1. Because I have 2 techniques. Okay?
Sizce?
Okay. I am ready. We did anesthesia at the entry point and anesthesia at the lateral half of the tract, or the lateral third of the tract. You put anesthesia here, doctor? Okay, Dr. Abdurrahim added 12 cc of anesthesia, and this is almost eyebrow. We did also anesthesia?
Yes, sir.
Okay, so 6, 6, 12, and 6, 18. 18 threads, 12 anesthesia is a little down. If we need more, we will prepare one syringe. If we need anesthesia at any level, we will add. The first thing we are using L-shaped cannula. So we have to do entry point. I use the 18G to the entry point. I use the 18G, okay, to enter the entry point. But the issue is, please never hold the needle like that. The needle has to be held like that from the distal end, so you never go deep. I need only a very, very little drop. Always hold the skin between your two fingers at the same area of entry. Make a little drop with 30G angle. Just a little, look, only this. I don't want the needle to go in, only the beveled part. And then you go out. Again, same story. Again, same story. 30-degree angle, 30-degree angle, 30-degree angle. And you have blood, you can compress. Okay? 30-degree angle, this is my last thread. So I finish one side of the face, I will compress all, and then I put my threads. So I keep this one here now. Inserting the threads in the face, in the neck, in the eyebrow is 3 stages. Stage 1, stage 2, stage 3. Stage 1 is to enter and take subcutaneous level. Stage 2 called drive with soft support. Drive with soft support. Stage 3 is the fixation. So, let us do the 3 stages. First, when I enter, by the way, this is not the only right way, but this is a very easy way to work for all patients. Hold the skin exactly in your hands as what you did before in entry point, like that. This is the open part. The open part should face up, not down. This is correct. You try to find the hole. Okay? And then, this is my 20 to 30-degree angle. I push till I finish the blue part. Push, push, push. Till here. خلاص. That means now I am in subcutaneous level. You can move the cannula up and down. When you move the cannula free up and down, that means in subcutaneous level. Now I will start stage number 2. Stage number 2 is drive with soft support. My finger is standing up, not sleeping on the skin. My finger is standing up, not sleeping in the skin. Please remember that. I don't want you to do that. That's very difficult to drive. I want to collect the skin like that, so I am easy to drive. Also, when you drive, don't drive towards the dermis. Don't drive with that angle. Driving either horizontal or with little angle down. Okay? So, we do, look at my hand to make a little angle down. You understand? It's clear what I'm saying? If I drive like that, I go superficial. I have to drive like that. So I go. And then I check again. Each time I drive, my eye should see, my hand should feel. Not just ta-ta-ta-ta-ta at the end, where I am good or bad, I don't know. No. Each step, carefully, slowly, each time I check, easy. Stage 2 again. Drive with soft support, but drive from up to down, not from down to up to down. Collect your skin with these 3 fingers. Your finger is standing, not sleeping. You have to see. So the patient, if it is in this position, I cannot work. She has to be like that, so I can see. Okay? Sorry, I know. I told you anesthesia here is less. Give me more.
I don't have anesthesia.
I have the hope. If you don't have anesthesia, the patient will have pain. So now, I put also on the other side to be on the safe side. Okay? So, Now, I started to do stage number 3. It's getting more tight. I'm afraid to be superficial. I will stage number 3, which is, okay, you lift this right hand up, you see, and you press with 2 fingers, please. These 3 fingers like that. I want pressure with 2 fingers. If you press with all hand, you cannot press good. But this, you can press good. Press, not support. Press. Okay? Press hard. Okay? So press, lift up and push. I know, madam, sorry. Press, lift hard and push. Okay? And each time I check if I am in the proper direction or no. If I am in my line or no. Okay? I have to check every minute, every drive. Press hard. Sorry, madam. You have to be careful. Patient with me. I finished number 1. Thank you. Look where I am. Do you see where I am? Okay? I went on to the temporal zone. Not stay at the hairline. The hairline is so early. There's no big deal. I don't have to make it in one time or one push. Just slow. Just slow. This is very uncooperative model and I don't like that. Okay? Try to handle with me the pain. Put anesthesia on the other side here, because this is the painful area. Look, I take long time, but at the end, what did I do? I pass. Because I slow. I do push. Oh, the cannula is twisted, I can't, no. Slow. Change your direction. Go a little, 1 millimeter down. Slow. Relax a little bit, madam. Yeah, bravo. Thank you so much. Okay, where I am now. Do you see where I am? Okay? It's here. Always press if you want to do more. Press up and push. Okay? Then you lift and go. I'll do the second half. Guys, please always work 1 cc anesthesia per thread. If you have 12 threads, you need 12 cc of anesthesia. Don't compromise in the anesthesia. Anesthesia makes you work relaxed and patient relaxed. So now again, I hold the tip. I work with the tip. Relax, madam. Okay? Like that. 1. Like that. 2. Like that. 3. Okay? Like that. Number 4. Number 5. And number 6. Okay? Thank you. We will start application. I always work from the right side. Huh? Unless you are left-handed, you can move to that way, but always it's more easy for you from the right side. Thank you so much. Okay, number 1, I hold the cannula, I pinch the skin, you see, it will be dead, okay. You hold the cannula, I pinch, I go. My hand is near, guys. If you are here, it's difficult. Your hand should be near, okay? And you should have a good angle, 20 to 30 to enter. Check, subcutaneous. Can you adjust? I don't know how to see. You see my hands now. They will not see the thread at all. I don't know what to do. Okay, I'll try to, okay, look. Then again, lift up, collect the skin and push. Again, and push. You see here? You see? Do you like this last drive of me? You like it? The needle now, the position of the needle. You like it? I don't like it. Why? It looks superficial. What I have to do? No. Hold the back of the thread and go a little bit back. You can go back, but you have to hold the thread like that. Look, like that. Together, we can go back. No problem. Now it's okay. Then I drive again. Slowly, press up. Slowly, press up. Okay? Till the end. What I have to do now? Number 2. Same concept.
Hocam.
Okay?
Açı değiştirmem gerekiyor da. Anladın mı? Açı
Stage
değiştirmem
2.
Göremiyorlar ya.
Okay?
Açı değiştireceğim.
But also stage 2 we agree with little angle till I reach here. Okay, bravo. Bravo. Thank you so much. Thank you. Stage 3. Up. Still here. If she didn't stop, I will not continue. Lift up and go. Number 3. Okay? Make sure before you are subcutaneous. I see a lot of people do what? They enter the cannula and do like that. What is this? Really, 90% of the doctor wallah, they do like that. Hey, do you think that you will be okay, you will feel it, but you will not know if it's wrong or right or where it is. You will feel it, that's correct, but you cannot do that. Thank you. A little angle and push. A little angle and push. A little angle and push. Look where I am. I am here. Okay? A little angle and push till the end. Look where I am. Here. You see? Here. That's my end. I am here. I already in the temporal zone. Lift the skin up and go. Marinate. Marinate. Hold the skin. Go. Slowly. Soft. Subcutaneous. Collect your skin so you can pass. Collect your skin you can pass. Collect your skin you can pass. Okay? I am here. Look. Start stage 3. Press and lift up. Press and lift up. Okay? You can press like that. You can press with big finger. Okay? Look, I am here. You see? Still I have around 1 kilometer to drive. Don't stop here. No result. You have to drive more. Press good. And then you lift up and push. You here. Last few millimeter. Then finish. Okay? Lift up and go. Last one for July. Hold. Stay on the hold first. Guys, don't push unless you are sure in the hold. Not like you pull, it's not going. No, you have to make sure you are in the hold first. Okay? Like that. Okay? Okay? Okay? Up. Up my right hand. Up your right hand. Up my right hand. And then, okay. Congratulations. Finish. Neck one. Look. That's my entry point. You see me? You can lift the skin up like that so you can see. Look. You can see when you pull the skin up like that. You can see the hole. Then you enter into the hole. Then you go subcutaneous. The patient has to flex now the neck. No, this is very difficult now. I cannot see. Understand what I'm doing?
Çok zor oldu. Tam ters oldu. Tam ters.
Şurayı alsam nasıl?
Yeah, it's okay. It's okay now. It's okay.
Böyle daha iyi. En az yandan biraz daha.
Collect the skin and push. Collect the skin and push. Collect the skin and push. Okay? Collect the skin and push. Now I press good. I lift. I press good.
Aşağı. Evet,
Okay?
biraz daha.
I press up. I press up. I press up. I press. Okay? Till the end. Okay? I know it's not easy to pass the first one, but try to be slow. Try to be slow. If you manage any difficulty, withdraw your cannula back, change a little bit, and go. Slowly. Milli by milli, no problem. Hit. You are knocking the door. They will open for sure. Keep going. Lift the skin and go out. Okay. We finish this case for the face. Can you give me a scissor? I want to cut and see what did we do. When you cut, it's very important that hold, press and cut.
Evet, oradan
Hold.
Oradan alın.
Hold. Stay back as you are. I will try to switch my position when I do the eyebrow. So the face and will remain the same. I switch.
Şuraya tutsana.
Okay, hold. Press down. When I mean hold, straight, strong. Not pull the thread, just hold it straight. Hold, press down, and cut when you are down. Look at this dimple. You like it? You like it? I don't. Just look. When this happened today or tomorrow or any day, just from up to down it will go. From up to down it will go. From up to down it will go. Okay, same story. Hold, press down and cut. Hold, press down and cut. Hold, press down and cut. Hold, press down and cut. You see all this dimple? It's very easy to go. Look, softly, softly it will go. Softly it will go. Dr. Abdo, I want to clean this alcohol, if you don't mind.
İyi misin?
I'm just cleaning softly, support your skin, try to clean. I just want to clean to show you some kind of findings. Please guys, always put good anesthesia. 1 cc per each thread. 0.3 at the entry, 0.7 distributed at the lateral half of the tract or lateral third of the tract, please. Because you will be relaxed, your patient you relaxed. By the way, the anesthesia is not affecting only the intraoperative pain. Anesthesia affects the post-operative recovery. Okay, when you feel the patient feel pain and trauma, there will be more inflammatory reaction. More inflammatory mediators will be released. You will have more swelling and more edema. Anesthesia is not only for the processes during the insertion. Anesthesia is very important for recovery time. If you have good anesthesia, you have shorter recovery time. Okay, please bear this in mind. It's not only for even during the application. Okay? Thank you, Dottore. Dottore. Dottore. Wow. Bellissimo. Okay. I finish the face. I want the patient to lean forward so we'll see. No, it's okay. Of course, we did a lot of marking for here, so it looks so hard to remove, but anyway, it's enough. Now I want the patient to lean forward. Sit down, madam, so we can have a look at you. Make your face just start straight. Look at the camera and the people will see. Look at the patient. I don't know if we make a clear photo or we show very clear at the, but you'll see in all the video. Look at all the landmarks. Look at the nasolabial. Do you see any more nasolabial? Okay, where is the marinade? How many cells we put for marinade? One only. Look, she even doesn't have a history of marinade. Look at the shoe line. I want you, madam, raise your hand, make a little bit up. Okay? Okay, again, yeah, thank you so much. Look at the shoe line, look at the face profile. Look at the lips. Did we touch the lips? Do you see any change in the lips? What happened? It's lifted up. Okay? So if you work in a proper way, you will create a new shape for the face. You will have a very good shape of the face. It's not about just inserting threads. It's about inserting threads in a very anatomical way. You have a very anatomical shape with this side effect, with this complication, with a nice shape. Creating a nice shape. We are creating a nice shape. It's not only just to apply threads. Okay, thank you so much. We will do now the eyebrow. Okay, that's an easy case, but we will have more difficulties. This is easy case, but we will have more difficulties. Oh look, but the patient looks what? Looks what? Younger. This is the only word that will come to my mind when I see the patient if I didn't attend this session. When she go out of the room, I am her friend, I will see her, I will say one word. You look younger. I don't know what she did. but she looks
Yo,
young.
unutuyorum şimdi dur.
Thank you. Madam, lie down. Look at the jawline.
Aynaya bakayım. Aynaya bakayım.
Yalla.
Tamam.
Let's finish.
Tamam.
Yeah, lie down. Thank you so much.
Lie down.
Now, give me one anesthesia.